Hi, I'm Tan. Today I'm going to talk about Isoptin immediate release 40 mg verapamil tablet. Verapamil is used in several conditions. It can control supraventricular tachycardia, angina, and improve oxygen delivery to the myocardial tissue. Hypertension can be managed by verapamil as well, due to its arterial vasodilation effect without producing reflex tachycardia. Other indications include atrial flutter and prophylaxis of cluster headache. Isoptin is taken by oral route. Peak plasma concentrations are reached between 1 to 2 hours after oral administration. Half-life of verapamil is ranging between 2.8 to 12 hours. The maintenance dose for angina, SVT, AF, and hypertension are 160 mg 2 to 3 times daily. Verapamil acts on myocardial cells and arterial smooth cells. It inhibits extracellular calcium influx through the transmembrane L and T type calcium ion channel. The blockage of the calcium channel will result in decreasing in the contractility of cardiac and vascular muscles, reduction in heart rate, and slowing down of conductivity of AV node. An improvement in the oxygen supply to the heart should be expected due to the dilation of coronary arteries. Additionally, verapamil has the ability to inhibit the intracellular release of the calcium for endoplasmic reticulum. As isoptin is taken orally, it must go through the gastrointestinal absorption. Verapamil is a P-glycoprotein substrate. PGP serves as an effective drug efflux transporter out of the epithelial cell and at the apical membrane of the enterocytes. It lowers the intestinal extraction ratio of verapamil, hence inducing a lower level of absorption. PGP also present at blood-brain barrier and limits the access of verapamil into the brain. On the other hand, the phase 2 first-pass effect has a vast reduction impact on bioavailability, which is around 20 to 35%. Verapamil undergoes undealkylation by hepatic cytochrome P450 enzyme. The subclass includes 3A4, 3A5, and 2C8. They forms noverapamil with only 20% of the pharmacological activity compared to the verapamil. The calculated log-P of verapamil is 3.53. Molecular weight is around 450, with no hydrogen bond donor and 6 hydrogen bond acceptors. All these physical-chemical properties fit the Lipinski's rule of 5, which indicates verapamil is a relatively small and lipophilic drug, giving rise to good membrane permeability. Thus, verapamil can go across the small intestine by passive diffusion readily, even though the active transportation is limited by PGP. Overall, the level of absorption is around 90%. Nevertheless, administered with a PGP inhibitor, the level of absorption of verapamil may further be improved. Verapamil is classified as a class 1 compound, having both high value in solubility and permeability, according to the biopharmaceutics classification system. This means the absorption of verapamil is likely to be independent of drug dissolution. For class 1 drugs, the absorption rate of compound is tend to be higher than elimination rate due to its high solubility and permeability. Thus, class 1 compound is especially suitable for the development of immediate release dosage forms. There are two verapamil enantiomers. The S isomer is 11 times more potent than the R isomer and 3.3 times more potent than the racemic mixtures, which results from stereospecific first-pass hepatic metabolism of R isomer. Consequently, it's hard to establish the relationship between drug concentration and patient response using conventional plasma concentration monitoring. Furthermore, the modified release formulation produces lower proportion of S form in plasma than conventional formulation. The swapping between two formulas need to be done more carefully. This formulation will result in rapid releasing of drug over a short period, which can increase the incidence of side effects comparing to the sustained release tablet. Also, unlike the sustained release tablet, it needs frequent dosing, which may affect patient compliance, particularly for treating chronic disease. Because verapamil is CYP enzyme substrate, it's more likely to have drug interactions. Grape juice needs to be avoided due to the same reason. Verapamil needs to be stored in an airtight environment with temperature ranging between 15 degrees Celsius and 30 degrees Celsius. We need to keep it away from light. In a normal environment, isoptin tend to be relatively stable. Excipients in isoptin immediate release tablets includes calcium hydrogen phosphate, microcrystalline cellulose, and critical carmellose sodium, and so on. The most important one is critical carmellose sodium. It's referred as a super disintegration, which is a water-insoluble and cross-linked substance. When it meets with water, it will swell and disintegrate the tablet rapidly, resulting in a fast dissolution. Microcrystalline cellulose and anhydrous colloidal silica also have disintegration property to aid the dissolution process. Microcrystalline cellulose, magnesium citrate, purified TAC, microgol 6000, and sodium lauryl sulfate serve as lubricants. They can deter ingredients from forming clumps and sticking to the tablet's punch and dies. Lubricants also ensure that tablet formation and injection can occur with low friction between the solid and machinery in order to lower wear on dies and punches. Anhydrous colloidal silica is a glidant. It plays a similar role as lubricant, but without reducing friction. Both lubricants and glidants are able to increase ingredients flow by reducing interparticulate friction. Microcrystalline cellulose, hypromellose, and microgol 6000 are binders. They hold the tablet together with the required mechanical strength. Other ingredients are bulking agents. They add the volume and mass to the tablet to make it easier to handle in the manufacturing process and convenient for consumers. Titanium dioxide has a high refractive index. Thus, it can sector light by acting as an opacifier agent. It may also be used as a white pigment to enhance the appearance of the tablet. In regards to patient requirements of the excipients, most of excipients are okay, but magnesium citrate has a faint odor because of the stearic acid and have a characteristic taste. Sodium lauryl sulfate is bitter with a faint odor. Microgol 6000 has a faint sweet odor, while those properties will not have a major impact on patient acceptance and adherence as tablet is swallowed and the size is small. Also, calcium phosphate dehydrate might not be an ideal excipient for this formulation, as it can act as a source of calcium. It attenuates the therapeutic effect of calcium channel blocker. That's all about my presentation. Thanks for listening. Bye.